Thank you so much for coming. My name is Jay Wilkins, and I want to talk a little bit about nitric oxide, so you're going to see the presentation on that as we go along. I wanted to give just a little bit of my background. It's not just super exciting, but at least wanted you to see why I'm talking about what I am today, about this whole nitric oxide deal. So I started in the health and wellness field. Back in 1993, I apprenticed under a naturopathic doctor and then got into practice myself as a naturopath. Got really into homeopathy and herbs and vitamins, detox programs, massage therapy, had a full spectrum practice, and got great results, and that was a lot of fun. And practiced from 1993 to 2005. And then in 2005, my eyes were opened to this whole nitric oxide world, which we're going to get into real heavily, and also a way to non-invasively see how people's circulation is. Because as people were coming into my office, at least 80% of them were dealing with a circulation issue of some sort, whether they recognized it or not. And so this pulse wave analysis was a way to be able to see where people were at, and then be able to see the effectiveness of the programs or the regimens that they were about to undergo. So I got involved in that in 2005 to present. From there, I formulated several nitric oxide-based programs and supplements for different companies, and then got into the manufacturing world, because that's a big deal, that products are made the way they're supposed to be, that the ingredients are in there as they should be, and you're using quality raw materials. And so I've been involved in the manufacturing world for the last 5 years. And then I started my own company in 2013 called Bionox Nutrients. So bio for life, Nox for nitric oxide. That's really the backbone of our product line, and continuing to work on new products. So I'm definitely a nitric oxide enthusiast. I hope by the end of the program presentation you will be a little bit more enthusiastic as well. So the name of the discussion is Nitric Oxide, Your Body's Best Medicine. So a little bit about nitric oxide. What is it? Well, it's a simple molecule, just 1 part nitrogen, 1 part oxygen. But as you're going to see, it has several benefits in your body. It's made throughout the body. It's made primarily through your endothelial system, the inner part of your arteries, your circulation, as well as through your nervous system and your immune system and other areas. There's some 140,000 research articles. This is according to the nitricoxidesociety.org. I encourage you to look there, but some 140,000 research articles. It was named Molecule of the Year in 1992. It has become the most researched molecule in history. It's led to the formulation of many pharmaceuticals, and it's really had its foundation. The exciting part was in 1998 when the Nobel Prize was won by 3 American scientists for the discovery of nitric oxide. So, as it says there, for their discoveries concerning nitric oxide as a signaling molecule in the cardiovascular system. This is very encouraging to me as a naturopath, seeing a natural substance that is being promoted. Unfortunately, a lot of people didn't hear about it, and it's still taking a lot of people getting out there and discussing it and making more awareness. So yeah, it led to the production of many pharmaceuticals, like the little blue pill that some people may be familiar with. And actually, Pfizer made this medication. It was supposed to have been a blood pressure medication. It didn't work very well for blood pressure, but the men in the studies were like, well, it does work for something, you just don't realize it. Started this whole class of medications for erectile dysfunction. So not only for erectile dysfunction, but also even eye health and Lipitor, statin drugs. One of the reasons it really works is not so much for lowering cholesterol, but actually for its nitric oxide production. So we'll talk more about nitric oxide now. What does it do? Well, I think the better question is, what doesn't it do? Because as you see there, it covers so many things. But what really got my attention is that when people have plaque in their arteries, there are natural interventions that you can do to reverse that plaque. You are not stuck with your plaque. So as you see there, the first thing has to do with reversing atherosclerosis. I love that word, reversing. Any sort of condition, anything that you can reverse condition-wise is good. You can reverse atherosclerosis. You see things in there for cholesterol, coronary artery disease, triglycerides, peripheral vascular issues, It even works on urinogenital type conditions like cystitis, prostate problems, kidney function. You also see really a lot of research in high blood pressure. In fact, I've not seen anything natural work as quickly and as effectively for lowering blood pressure as arginine and nitric oxide based nutrition. We're going to talk about why here in just a little bit. Human growth hormone. This is your hormone of youth. So taking this before you go to bed also helps you to sleep better, to recover. It's it's the hormone of youth. Great for skin and those type of issues. Sexual function, as we spoke about. Muscle health, so people that work out, very good for promoting lean muscle mass. Helps for endurance, stamina. You look on the other side there, a lot of things for diabetes issues, both for helping with diabetic complications as well as even insulin type issues. Improves osteoporosis. This is something that I personally had benefits with. I was starting to have bone loss. I had a scan done. I increased my arginine, which increases nitric oxide, and I went back for another scan, and my bone health had returned to normal. So I've seen that myself. So we see a whole host of different things: heart failure, cancer treatment, Alzheimer's. So the list goes on and on. You can see why it's the most studied molecule in history. It's called a miracle molecule for a reason, for these very reasons. This is a slide that helped me a lot as I was first learning about it, to see how powerful arginine, which is a precursor to nitric oxide, and nitric oxide therapy can actually be. This was a study that was done by both Dr. Ignarro, one of the Nobel Prize winners, as well as Dr. John Cook, who's the head of cardiovascular research at Stanford. And so we see over to the left side in group 1, these are rabbits. They gave rabbits a high cholesterol diet. This one on the left, group 1, is where the rabbits were given a regular rabbit diet afterwards, and you see no change in the plaque formation. Group 2 is the rabbits were treated just with L-arginine. Group 3, just citrulline. Group 4 is citrulline and arginine. Group 5 is just vitamin C and vitamin E. Group 6, arginine and vitamin C and vitamin E. And then group 7, you see arginine, citrulline, vitamin C, and vitamin E. So you see results in every category other than just the regular rabbit diet, but you get the best results when you add all 4 of those components. So you definitely see a synergistic effect when you take precursors to nitric oxide with arginine and citrulline, but then also use antioxidants like vitamin C and vitamin E and other things. It helps to sustain the nitric oxide benefits. Here's a few books I highly recommend. These are books I read back in 2005, and they really changed the way that I looked at people coming to my office and people's health in general. So excellent. This is one of the ones that was written by the Dr. John Cook, The Cardiovascular Cure. What is the cardiovascular cure? As you read the book, it is nitric oxide. And he's the head of cardiovascular research at Stanford. No more heart disease. NO stands for nitric oxide. No more heart disease. How nitric oxide can prevent, even reverse, heart disease and strokes. This was written by Dr. Ignarro. And then finally, The Arginine Solution by Dr. Merrill and Fried. And this also shows the benefits of arginine-based therapies and producing nitric oxide. Like it says there, the first guide to America's new cardio-enhancing supplement. Excellent books. Highly encourage you to look at them. So how does your body make nitric oxide? We see how great it is, all the things it does. How do you make it? Well, there's a few different ways. You've heard that laughter is good medicine, and it truly is. It produces nitric oxide in your arteries and is very healthy. Exercise produces nitric oxide. As far as things that you could consume, as far as diet, foods that are high in nitrates. So that would be beet powder, arugula, kale, spinach, all your green leafy vegetables are very high in nitrates. Those are healthy, naturally occurring things in these foods. There's various waves, like infrared waves, and there's a unit called the Beamer that actually have a booth here that also helps to produce microcirculation, improving nitric oxide. Small amounts of alcoholic beverages, like one alcoholic beverage, increases nitric oxide. You go past that, it decreases nitric oxide. So as you can see, moderation is the key. And then where most of the research has been is with arginine and citrulline. It's a semi-essential amino acid. So you get these from nuts and fruits and eggs and fish, and or you can get it through a dietary supplement, and it is a precursor to nitric oxide. It's a semi-essential amino acid, which means that your body makes a certain amount of it, like 5 grams per day. The rest you need to get from your diet. So we'll talk about those things in more detail as well. What causes a decline in nitric oxide? The number one reason for a lack of nitric oxide is age. That's the given. So once you hit the age of 40, you see that your nitric oxide levels decrease by 50, maybe even 60% compared to when you were 20. So it helps you to see why when people hit the ages of 40 and 50, their risk for cardiovascular disease is so much greater, is because of nitric oxide. Things that cause a decline other than age, as you see, genetics, ethnicity, diet, medications, stress, which leads to oxidation, as well as smoking. You smoke a cigarette, you kill your nitric oxide production for at least 8 hours. So it's very damaging. Now on the left-hand side, or I guess you're right, you see on the top level there, you see what a normal artery should look like. This is where your blood's flowing good. The inside of your artery, just that one layer thick there at the top, or the inside, that is your endothelium. That is where the rubber meets the road, as it were. That is where all the good things or bad things can happen to your cardiovascular system. You need your endothelium. The word picture that Dr. Cook used was you want your endothelium to be like Teflon as opposed to being like Velcro. How do you get it like Teflon? You want to increase your nitric oxide levels. That's what keeps it nice and healthy. So the next slide, you see what happens over time. You get some inflammation and you get endothelial dysfunction. You start the process of plaquing. The fatty streak begins to form. That's where you have oxidized lipids or cholesterol. You get inflammation, you get white blood cells. This is all your body's efforts to keep your blood vessels from blowing out. So it puts this plaque there to try to kind of patch it up so that your arteries don't blow out the other way. But over time, that plaque will begin to grow, and these plaques, what they consist of is, again, white blood cells, inflammatory chemicals, heavy metals. You basically got a pus-filled boil that's brewing underneath that endothelium. And the dangerous part is, like on that last slide there, the last figure, is because of the narrowing, you create almost like a whistling effect, a vibration that will knock the cap off, and all this stuff, this vile things spill out. Your body compensates by creating a plaque, or excuse me, a clot. That clot can shoot upstream. It's going to find the most narrow area and get stuck. So if it's in your carotid arteries and you got blockage there, it gets stuck there, or in your brain, causes a stroke. Gets stuck in the coronary artery, it causes a heart attack. So that is the leading cause of heart attack and stroke, is actually what's called unstable plaque or vulnerable plaque. These plaques that burst open and then it causes a clot to form. So here is the way we'll talk about as far as your diet is concerned, that amino acid. Your body uses arginine and citrulline, these amino acids. It is converted by the endothelium by something called eNOS, or endothelium nitric oxide synthase. It creates nitric oxide, and the very first good thing that happens is it causes vasodilation. So if your arteries are constricted for one reason or another, it helps to relax them, and a natural byproduct of vasodilation is your blood pressure will return to normal. If your blood pressure is already normal or low, it doesn't cause it to go down anymore. It just normalizes your blood pressure. So very effective for blood pressure issues. So besides the arginine and citrulline pathway, you also have the nitrate-nitrite nitric oxide pathway. So this is a different way that your body produces nitric oxide. This is through dietary consumption of things like we talked about, beet powder, arugula, kale, spinach, your green leafy vegetables. What happens is you consume those, and when you have good mouth flora, so we talked about probiotics for your gut, but you also have probiotics in your saliva. And when you have a healthy pH, a good microflora in your mouth, then your body takes these nitrates and converts them into nitrites. So you get absorption of nitric oxide right from the very consumption and chewing of nitrates. And then those nitrates or those foods will move down into the stomach. It mixes with the acid, and then you get further consumption or metabolism of these nitrates into nitric oxide. Then the food moves into the small intestine. Again, you get more production of the nitric oxide. So you produce this through your digestive system with the nitrates. And then even you can store some of those in your saliva. This is Dr. Michael Greger. Highly recommend that you go to his website, go to his YouTube channel. He does these really good small or short videos, kind of funny videos, but very educational. Highly recommends nitrates. It's also recommended in the DASH diet, which stands for Dietary Approaches to Stop Hypertension. The DASH diet was named, I think, by Forbes magazine to be the best diet for the last 8 years. It's a very sound diet. It just makes a lot of sense, but they suggest, especially if you have high blood pressure, that you eat a lot of nitrates. So again, lots of beets and green leafy things to be able to help you to lower your blood pressure. If you were to make a nitric oxide boosting supplement, how would you make it? Well, the first thing that you'd want to do is to make sure that you have the correct amounts of arginine to citrulline. So again, it takes a therapeutic dose of it. So at least 5 grams of arginine per day, at least 2,000 milligrams of citrulline. And the two of those together, what happens is the arginine is converted into nitric oxide first, and then the citrulline has sort of a time release effect where you create nitric oxide a little bit later, and it converts back to arginine. So they work very well together. And if you take the right dose with the right ratio, 12 hours apart, then you actually get a 24-hour release of nitric oxide. And that's the best way to do it, is even while you sleep, creating nitric oxide. The other thing is mentioned, you want to not only stoke up the arginine pathway, but stoke up the nitrate pathway, again, through the beets and the other green leafy vegetables. The other thing that's very important, as we saw on that slide for atherosclerosis, remember, it wasn't just the citrulline and the arginine, but it was antioxidants. So how do antioxidants play a part? Well, nitric oxide is very susceptible to oxidation. And so you want to have the antioxidants to protect the nitric oxide from breaking down. So when you add things like vitamin C and vitamin D, which with vitamin D, you really want to be doing at least 5,000 IUs per day. That's according to the vitamindcouncil.org. And that's just to maintain health. If you're having some sort of health issue, you even want to do more than 5,000 IUs. And as you're aware, it's an epidemic in this country, the vitamin D issues and deficiencies. You get antioxidants from pomegranate. A lot of great studies on pomegranate for cardiovascular health. Camu berry, which is very high in vitamin C. Grapeseed and grape skin extract as well. The other thing that you want to do is you want to make sure that your system has a good pH, including your mouth pH. Remember, we talked about the good microflora. Well, your mouth pH is very important for producing the nitric oxide in your digestive system, but also even your whole system. You want a good alkaline pH. The other thing that's very important is where you produce this nitric oxide is the inner part of the arteries we mentioned called the endothelium. So you want to use nutrients or herbals that help support health of your endothelium. Those would be hawthorn berry. Those work very good for the heart. Green coffee, we've seen chemicals in that actually help for lowering blood pressure. Horse chestnut, which helps more for the lower extremities, the arteries, as well as Indian gooseberry, which is an Ayurvedic herb, also called amla, very good for producing nitric oxide. The other thing that's very important is if you're going to take all these things, you want to make sure you absorb them. So one of the things that come across is something called estrogen, which are Chinese herbs, astragalus and ginseng. And it sort of heats up the digestive system to increase your absorption of amino acids by 60%. So you increase your arginine and citrulline absorption by over 60% by using the estrogen complex. So here's my shameless plug about the product that I came up with called M3 Miracle Molecule Max. I took all that I knew, all the research that I had done, all the latest things as far as nitric oxide, and try to put it into one product. So you see the vitamin C, the vitamin D, the vitamin E is all in there for the antioxidant protection, and the vitamin D in the right dosage. Interesting thing about vitamin D as far as cardiovascular health is concerned, one thing that vitamin D does, as you probably know, it helps for your calcium metabolism. So if you're looking for something to support your bone health, you take calcium plus vitamin D. Well, the other thing that vitamin D does is it helps to get calcium out of areas it shouldn't be. And one of the places that calcium tends to get into is your arteries. So by actually using vitamin D, you help your risk of cardiovascular issues as well by helping calcium get out of those areas that it shouldn't be. The nitric oxide blend has those right ratios of arginine, citrulline, beet, pomegranate, and watermelon. Watermelon, the word watermelon actually means citrulline. It's very high in citrulline. And I use a form of arginine that your body utilizes better. Arginine for some people can cause digestive upset, but the type that I use, the alpha-ketoglutarate, actually resolve those upset tummy issues, and it really helps for the absorption of the arginine. And then we have the berry blend. It's a naturally flavored product. And we have the endothelium recovery blend as well, which has your hawthorn, your horse chestnut, green coffee bean extract, and Indian gooseberry, the antioxidant benefits of the grape seed and grape skin extract, the camu berry, which is, again, very high content of vitamin C. The other thing that camu berry does, it helps to lift the mood. So we'll get into this a little bit later, but a lot of people have seen excellent results for their depression issues and those type of things. Deep ocean minerals to help the pH balancing and the absorption, as well as that complex estrogen so that the whole product absorbs. Again, we use just natural sweeteners, natural flavoring components to make the product taste good. Arginine tastes very bad by nature. Some people compare it to like rotten fish or smelly gym socks, neither of which are that appealing. So it takes a lot to try to make this to be palatable and taste good, but we did it. So you don't have to worry about taking the M3 and thinking about dead fish or stinky gym socks. It has none of those things. It has sort of a raspberry lemonade type of a flavor. How do you know if you need the product? Well, as I mentioned in the outset, that I've done a lot of training and investigation into pulse wave technology. This is a little non-invasive test. It actually has FDA clearance, and it does the things that I'm gonna tell you, but it's a very short test, just takes about 3 minutes, and it does a simultaneous plethysmography test, which tests your arteries, as well as a heart rate variability test, which tests for stress issues. So on the left-hand side, you see the stress analysis. So it measures your autonomic nervous system to see how balanced you are with your sympathetic to parasympathetic nervous system. It measures your physical as compared to mental stress. And then it gives you a number as far as your stress resistance, that is how healthy you are to deal with stress. And then it gives you a stress score. So anything in the 50s is a pretty good stress score. At the top, you also see it measures your heart rate and to see if you have any skip beats. On the right-hand side, you notice the arterial health analysis, and it does a large artery elasticity test, a peripheral artery elasticity, which would be like into the hands and feet. And then it boils everything down to a score and a type. So type 1 is your best case scenario, all the way to type 7 being the worst case scenario. It shows where you're at in between there. And so this is actually one that I did on myself. So you can see, I'm 48 years old. That's about a biological age of the arteries of about a 30-year-old. So the arteries are doing pretty good. I've been doing this since 2005. My arteries are as good as when I started back then as they are today. So I'm happy about that. What we see is that when people will use a good nitric oxide based formula, let's say they test as a type 3 or a type 4 or worse, if they'll do that over a period of 90 days and you do a retest, 90% of the time they'll start to test better. So that's what told me it's a completely objective test, and it's showing that the results of what this nutrition can do, it's verifiable. So I was real excited to see that there's a way to test the effectiveness of this nutrition. However, the test is not necessary. As we talked about before, if you're 40 years old, your nitric oxide levels are starting to come down. So you would do well to use this product. Definitely if you're dealing with any sort of cardiovascular issues, And we've seen the gamut from heart function issues, blood pressure issues, diabetic type of complications, you name it. If it has anything to do with your arteries or heart, the research all substantiates just how well this works. Lipid disorders, so like cholesterol, triglycerides, those type of things, blood sugar problems. Arginine is also a precursor to insulin production. So your body, to make insulin, you need the right amounts of arginine. Also, for your cells to be sensitive, we see nitric oxide helps with insulin sensitivity. Your immune system, your T cells, your B cells, your macrophage, they all use nitric oxide to be able to destroy invaders, pathogens that shouldn't be there. Eye issues. The number one issue that people have with glaucoma or any sort of macular degeneration is really those small capillaries in the eyes start to block up. The circulation doesn't get to the eyeball, the nutrients can't get there, and the eye starts to die and starts to have these complications. And so by restoring nitric oxide levels, people have seen really great results with their eye problems as well. Energy, of course, that is a given as you increase your circulation. People's energy returns. Sleep, as we mentioned before, raising those human growth hormone levels before you go to bed through arginine supplementation is very important. If someone's interested in reducing their amounts of medication, of course, it would be something you talk to your doctor about, but a lot of people have been able to do that. And it just makes sense, right? As your body gets healthier, your needs for the medications is going to go down. Sexual dysfunction, again, the reason that men and women have sexual dysfunction many times is a lack of circulation, a lack of nitric oxide getting to those areas. Brain health. So again, by increasing circulation to the brain, the other thing that nitric oxide is a neurotransmitter. So it's a precursor to good chemicals like serotonin and dopamine, all your happy chemicals. So along with the camu berry that's in there, a lot of people have seen a nice change in their moods, their depression, even very serious cases. Athletic performance, people will use this type of a product before they work out as well as after they work out. So during a workout, it helps with stamina, endurance, and after a workout, it helps for recovery time, and it increases lean muscle mass. So it's an excellent thing to do both before and during and after a workout. Inflammation, that's the other thing that it helps with pain and inflammation. So a good example of a drug that helps for pain would be morphine. The reason morphine works is because of the nitric oxide that it makes. So you see how powerful nitric oxide can be. So I noticed a lot of people that were starting the product, they were taking it for their circulation, but they come back and they say, you know what, my knees don't hurt anymore, my joints don't hurt anymore. Could it be this product? I said, well, the research substantiates that by producing nitric oxide, your inflammation levels go down. So it does a lot of different things. So if you're dealing with any of those issues, definitely this product would be for you. Here's just a few testimonials of people that I know. Dr. Rasmussen, he is down in the Fayetteville area, chiropractor down there. He says, I've been using and recommending M3 for over a year now. I've had hundreds of patients using it and indicating outstanding results. One 86-year-old patient was having high blood pressure issues, but a recent doctor's visit showed excellent improvement. In fact, her doctor said, you have the blood pressure of a teenager. Whatever you're doing, keep at it. This came from Louise. Her husband has diabetes and she deals with a condition called AFib, where it's atrial fibrillation with her heart. And she said, I just wanted to say that my husband and I have both benefited from taking M3 every day. Wayne's cholesterol has come down to normal and he doesn't have to take dangerous meds. In fact, all his blood work is in the normal range now. I have AFib and can feel a huge difference since taking M3, so much so that I don't need medication for it. Thanks for the M3, it has helped us both. Joanna, she's a massage therapist, cross fitness enthusiast, says, I can tell a huge difference in my energy. I put a lot of physical demands on my body, and I can tell that my recovery time is much less. I'm pretty much addicted to this stuff, and I've been telling everyone about it. Mike, he's close to 80 now, I believe, and he said 18 years ago I had a 4-way bypass operation for clogged arteries. I've been regularly taking M3 for the past several years. It works much better than I could have imagined. I enjoyed walking, riding a stationary bike, and rowing. My blood pressure has been good, and my surgeon says I'm doing great. No blockages. So this is just an example. Of course, everybody's results vary. You can see more testimonials on the website if you want to go check that out, bionoxusa.info. So again, name of my company, Bionox Nutrients, bio for life, NOx for nitric oxide. The tagline is harness the medicine within, because it's really your body's own chemistry that's the best healer. So all the hormones that you make, all the neurotransmitters that you make, all the good chemistry your bodies make, all the nitric oxide that you make, those are your best healers. So that's why we encourage you to do things that really boost your own body's ability to heal and to achieve optimal health. So I encourage you to do that. Harness the medicine within. I thank you for your attention.